Go ahead, ma'am.
Hello all, I am Dr. Hema Vaithianathan, Fertility Consultant at Oasis Fertility, Chennai. So in this session, let's understand about an important topic, which is repeated pregnancy loss and how IVF can help in couples experiencing repeated pregnancy loss. So let's understand more about this in this session. Um, so let's first understand when do we call it as a recurrent pregnancy loss or a repeated pregnancy loss. So it is common that around 20 out of 100 pregnancies miscarry, and these are all some called as sporadic miscarriages or pregnancies miscarriages that occur by chance. But only about only about few percentage of couples experience this repeated pregnancy loss, which is actually a very frustrating experience for couples when they experience this, and it is about it can happen in about 2 to 5% of the couples in pregnancy. So, where we call it recurrent pregnancy loss and start testing or start investigations and plan treatment if it is a recurrent pregnancy loss, that is two or more failed pregnancies. So, repeated pregnancy loss is said when there is two or more failed pregnancies in a couple. So, it needs investigations because we can find some of the causes that can be treatable in order to reduce the chance of miscarriage in the subsequent pregnancies. So it needs a certain testing after two or more pregnancy losses. So it can be in the first trimester, that is, it can be 12 weeks in the first 12 weeks of pregnancy, or it can be even between 12 to 24 weeks of pregnancy also. So even any pregnancy until 24 weeks of pregnancy can come under this kind of pregnancy loss, and if it is happening more than twice, it can come under this recurrent pregnancy loss. Also, there is another type where there is a primary RPL or primary recurrent pregnancy loss and a secondary recurrent pregnancy loss when the couple has had a previous delivery. And it requires, as I mentioned, it requires a certain set of special investigations to find out if there is any underlying cause in order to correct that and reduce your chance of miscarriage in the subsequent pregnancy. But even after extensive investigations, about 50% of the time we do not know what is causing this kind of a recurrent pregnancy loss. So let's understand more about what actually can cause recurrent pregnancy loss. So recurrent pregnancy loss, like any other sporadic miscarriages, some more common reasons, like some most common reason any miscarriage happens, repeated loss can happen is because of chromosomal abnormalities in the embryo or the fetus that is formed. So that is the most common reason why pregnancies fail. And it can be because of some genetic variations or because sometimes the parent may be carrying some chromosomal abnormalities known as balanced translocations or structural rearrangements that can result in the formation of a defective embryo chromosomal problem that can cause repeated miscarriage in couples. And only if we understand these reasons, the underlying reasons why miscarriages can happen repeatedly, we can plan our investigations or tailor the investigations based on the individual couple's needs. And the second most common reason why miscarriages can happen is because of uterine variations. So, as mentioned, it is not just any structural problem in the uterus like fibroid uterus or adenomyosis. Sometimes the uterus can be congenitally abnormal, known as uterine anomalies. And the most common anomalies seen in this set of couples or women experiencing repeated pregnancy loss is septate uterus or sometimes biformate uterus. These are the type of uterus, anomalous uteruses that can be implicated in repeated pregnancy losses. And many a times there can be immune problems, that is autoimmune problems in the mother can initiate a miscarriage or early pregnancy problems if the mother has an autoimmune issues. And more specifically, there can be problems like acquired thrombophilia or acquired problems with clotting disorders that can cause early miscarriages. And as mentioned, blood clotting disorders, any problems like antithrombin deficiency, protein C or protein S deficiency, the medical terms, but it's actually some kind of a clotting factors deficiency can lead to early miscarriages. And also other medical conditions like any uncontrolled or overt hypothyroidism, thyroid autoimmunity, and sometimes uncontrolled diabetes mellitus can also increase your chances of miscarriage. But only repeated miscarriages happen in a setting where this is this kind of hormonal imbalance goes uncorrected or where it is not brought to a balanced state. So hence, these are some of the etiologies or the reasons why repeated miscarriages can happen. Hence, we have to take a detailed history when a couple present with repeated miscarriages. It is important that a detailed history is taken to understand the couple's medical problem and to understand the couple's underlying lifestyle factors to plan our management subsequently. So, when these are the investigations, hence it is not a list of investigations that we can do for every couple walking with repeated pregnancy loss. It is only a tailored investigation or a personalized investigation that can help in a particular couple to identify any underlying clinching, the underlying diagnosis. So some of the common tests that is done for couples is chromosomal testing, known as karyotyping of the couple. Is one of the tests after individuals risk assessment, after understanding the individual's family history of genetic issues and family history of having child with genetic problem, having a family history of children born with birth defects. These are all certain indications after risk assessment that we select for karyotyping of the couple. Karyotyping of the men as well as women can unfold any presence of underlying karyotypic abnormalities, chromosomal abnormalities, deletions, inversions, translocations, and other karyotypic problems can be uncovered after this testing. Because if any karyotypic abnormalities is diagnosed, then we can arrange for a detailed genetic understand the couple's genetic background, family, and then we can plan certain interventions or certain management according to their next treatment cycle. So some of the most common tests which I will explain in the later slide is this PGT, and along with that PGT M and PGT SR can be certain type of testing that can be indicated in couple with chromosomes. And the most important investigation that I would say is this uterine cavity evaluation. So uterine cavity is the place where the embryo implants inside the endometrium. Hence, the uterine cavity problem has to be ruled out before the couple attempt for the pregnancy. So that if uterine cavity problems like submucosal fibroids or uterine cavity issues like adhesions or where the inner lining is thin or it has problems like infections known as chronic endometritis, tubercular endometritis. So these are certain problems, or as I mentioned, the most common uterine anomalies in a couple with RPL. These are the things that has to be ruled out or that has to be diagnosed in a experiencing repeated pregnancy loss. Also, as apart from these two testing, general testing go on, like testing for thyroid issues, thyroid autoimmunity, testing for high prolactin level in the blood, and testing for having uncontrolled blood sugar in the system. This can also help us reduce your risk factors that can increase your chance of subsequent miscarriage. As mentioned, chromophilia testing, which is actually an acquired chromophilia known as antiphospholipid antibodies testing, is also a common and a most important recommended test for couple experiencing repeated pregnancy loss. So, with respect to the topic per se, which is fertility is actually like infertility is not a problem in a couple experiencing miscarriage, but still IVF can offer them some solution in certain couples. Let's understand why and how IVF can help in couples experiencing recurrent pregnancy loss, even though they do not have a problem with conception. But not our recurrent pregnancy loss or because of natural conception. Even with IVF or even with assisted reproduction treatments, recurrent pregnancy loss can happen. So in that way, we can have to identify and tailor your management, and additional treatment option has to be added in your next treatment cycle, because IVF in IVF treatment, the couple undergoes some extensive pre-IVF evaluation and their health and is optimized before even starting the treatment. As I mentioned, a woman's body weight, being underweight or being overweight, can affect your chances of miscarriage. Hence, maintaining an ideal BMI is important. Hence, before IVF, we do lifestyle factor optimization, which is maintaining your body weight in an ideal range, quitting smoking, and not having excessive alcohol consumption. And these are some environmental factors and lifestyle factors that needs to be optimized before even you start your treatment. So pre-IVF time, you can undergo all this screening and optimization of your general health, which might reduce your chances of miscarriage. And also with IVF or any fertility treatment, if you undergo in the setting of RPL, you can reduce your time to conception if that is a problem for you. Also with IVF, there are add-on treatments that can be added in order to select a good quality sperm, in order to improvise the chances of fertilization, in order to identify that embryo which is healthy. So some of the add-on treatments that can help during IVF is your sperm selection technique. And out of these sperm selection techniques like microfluidics or MAX can help the healthcare professionals to select the best quality sperm to utilize for IVF treatment. And also there is a intervention known as ICSI, which is intracytoplasmic sperm injection, which can be used for semen abnormalities or sperm abnormalities. So to overcome problems like poor fertilization or formation of poor quality embryo can be bypassed with the use of ICSI. So ICSI is one of the add-on treatment that can help in such situations. And next is about PGT-A and PGT-SR. As mentioned, this is the most important piece of add-on treatment that can help couple with RPL, especially with a genetic background issue or abnormality that is leading to miscarriages. So PGT-A is an embryo selection testing. So it is not a treatment for embryo, it is only an embryo selection process where embryos can be genetically tested for abnormalities like aneuploidy problems or for structural rearrangement or some disorders. And then the embryo that is healthy and which is devoid of all these chromosomal problems can be selected for transfer in order for us to increase the success for the IVF treatment, as well as for us to reduce the chances of miscarriage. This kind of an add-on treatment can definitely help couple with recurrent pregnancy loss. And also during IVF, an immunological treatment can be added, and it can be supported and added around the time of your and around the time of early implantation and early pregnancy. Some immunological treatment can help couple overcome this autoimmune issues. And also around the time in IVF, around the time of transfer, around the implantation, and even before testing on hormonal support. So unidentified problems like luteal phase deficiency or problems like early pregnancy, autoimmune problems can be overcome because you are under hormonal support, your treatment, medical support during your embryo transfer, your pregnancy testing. And also once you have tested positive, you are being supported with and other supportive medications in your early pregnancy. So this is going to take care and reduce your chances of miscarriage because of the reasons in IVF. So these are all some of my points about how IVF can help couple with recurrent pregnancy losses. So it is not, IVF is not the solution for all the couple experiencing pregnancy loss to reduce the chance of miscarriage. But certainly if there is any risk factors, if there is any underlying factors or contributing factors that can lead on to RPL, then these factors can be optimized and controlled during your IVF treatment. So just elaborating on the same fact, in recurrent pregnancy loss, even if the semen analysis is normal, even if the sperm looks normal, there can be problem with the DNA. The recently proven association between DNA fragmentation in the sperms and increased risk of miscarriage is there. So hence, in coupled with RPL, this kind of sperm DNA fragmentation testing can be carried out in the male, especially if the male has unhealthy lifestyle factors like excessive alcohol consumption, smoking, or exposure to environmental factors because of this occupational exposure. And if he is exposed to any hazards, then definitely, and also obesity or presence of any varicose that can guide us whether this DNA fragmentation testing is necessary in order for us to employ some sperm selection techniques in your next fertility treatment. And as mentioned, sperm selection techniques, if employed in an IVF cycle, it can improve your sperm quality and overcome any potential male subfertility issues in RPL couples. And as I mentioned, ICSI is another add-on treatment that can help couples with male factor problems, sperm abnormalities, poor sperm count, poor sperm motility, and abnormal shape of the sperms, ICSI can overcome some of these sperm fertilization defects and formation of poor quality. And as I mentioned, ICSI can be employed even when testicular sperms are utilized in a IVF cycle, or when we are using cryopreserved eggs, or those women who has very low egg reserve. ICSI can help in this category of women. And as I mentioned, the most important intervention that we can offer is the PGT, or the pre-implantation testing. It is an additional treatment during your IVF cycle. It can be of three types, like PGT-A, which is a general and PGT type of testing, which is the PGT for aneuploidy testing. And then there is PGT-M, which is the genetic testing of the embryos for screening for the presence of monogenic problem or a single gene disorders problem. And PGT-SR is when there is specific karyotypic abnormality in the couple. Then PGT-SR can help identify the healthy embryo. So PGT is not done in all the IVF cycles. PGT is indicated only in certain indications during your IVF cycle, and one of the indications is having repetitive miscarriages. The other indication why PGT is done in certain IVF cycle is when the woman is having advanced maternal age, especially 35 years of age, or if there is severe sperm abnormalities, or if the couple has had multiple previous IVF attempts with formation of poor quality embryos, or formation of embryos, or pregnancy, prior pregnancy with a chromosome abnormality, then PGT-A can help. And there are so many other add-on treatments in IVF as well, like assisted hatching, which is an opening can be made if the egg or if the embryo has a very thick outer shell, then an opening can be made to assist the embryo in hatching before implantation. So there are several other add-on treatments that can be tailored based on your based on the necessity. So one of which is assisted hatching, the other is using embryo glue, which is a biologic glue that can help in during implantation of the embryo. And other immunological therapies can be tailored according to of the couple in order to improve the chances of success during your treatment cycle, and especially and most importantly to reduce your chance of miscarriage in your next treatment cycle. So I hope this addressed all the reasons of why a couple might experience recurrent pregnancy loss, and why a couple need certain special investigations during the treatment cycle, and what all, how and in what way IVF can help in a couple experiencing recurrent pregnancy loss. So I can answer any of the further queries if you have, if you reach out to us, and thank you all for your patience.